Find out why claims of high-definition eye surgery may be a bit out of focus. Up next on Comcast Newsmakers.
Bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Welcome back to our show, everyone. Ads have been touting a new procedure for LASIK surgery, claiming to give patients high-definition vision. But this hour's Newsmaker says, for now, the only way to purchase high definition is at your local electronics store. Dr. Cory Lessner from Millennium Laser Eye Centers. Welcome to our show.
Thank you for having
now,
us.
This is something that is more of a marketing ploy than anything else?
I don't know if I'd call it a ploy, but I think call it a euphemism for just our surgeons out around the country wanting to let consumers know, patients know, that the LASIK of today is different than the LASIK of several years ago. The quality of the outcomes are superior.
Okay, so it's not totally untrue, but high definition, you're not increasing the pixels of of what's going into your eyes.
Well, people understand high definition and compare it to the way their television picture was in the old days. Years ago, we used to be able to look people in the eye and say your vision is going to be almost as good or as good. Now, with current technology, vision is typically as good, and in many cases, maybe up to 50%. See better the day following surgery than they ever saw with their glasses or the contact lenses.
What recent refinements have made to the procedure to make it better?
Well, for several years, we've had custom like technology, and this uses what's called the wavefront, which takes a picture not of the cornea, but of the way that the eye processes light and plans a treatment pattern out for your specific eye. We've even evolved beyond that with speed and precision that just was unheard of years ago.
We hear a lot about LASIK, but for many people out there, they don't know exactly what goes on when you have LASIK surgery. Of course, lasers are used, but what happens to the eye? How is the eye modified?
It's actually a two-step procedure. We create a very thin flap of corneal tissue, and one of the greatest differences now is that we're using lasers. There are no blades to make the flap, so they can be made much thinner, much more precise, and in doing so, we save more tissue for the actual treatment. And so many people that weren't candidates years ago are now in fact candidates, and can even have the potential for touch-ups, which we'll call an enhancement down the road. People that couldn't have even had the surgery can now have the surgery and maybe be able to still have more in the
When
future.
you have LASIK surgery, is that forever? Is it a procedure that really you don't have to have refreshed or modified in the future?
It depends on the stability of the patient's prescription. A person that has a -3 prescription now that was -3 5 years ago and would have been -3 5 years from now, if we reset the clock for them, so to speak, they're going to have no prescription 5 years from now. But if their prescription kept creeping up year after year, we're going to reset the clock, but they may go up a little bit. It doesn't stop the natural progression of change in prescription.
Is there a minimum threshold for this type of procedure, or anybody who is off maybe even less than one dioptic, can they go there and get some treatment?
If you're dependent upon your glasses, in the past it was just for distance. Now there are people that are even doing one eye for reading that tolerate that strategy. But if a person says, no, I don't want to be dependent upon these, and I do feel like I need to wear them the majority of the day, they can come in and be tested, and if they like it, then we can do it for them.
Okay, here's another one for you.
Sure.
Let's say I'm nearsighted, so I have it's blurry vision far away, but I can read well. If I have LASIK surgery, will I have to wear reading glasses?
You would, and typically what we would do if a person has good reading vision without glasses and they're over the age of 40 is we would see how treating one eye would work for them. And it's not intuitive. You have to see what it does for you, and usually if we do it right, it takes a couple of weeks to get used to, but...
Okay. All right, well, great information. This hour's Newsmaker, Dr. Cory Lessner, reminding us that high-definition technology is for TV and computer screens, not eye surgery. I'm Spiro Kent. Thanks for watching.
The preceding has been a presentation of Comcast Newsmakers. And now, back to CNN Headline News.